pharmacology. So what is the cytochrome P450 hepatic pathway? Hopefully you might have covered this in pharmacology. But in 1958, the P450 system was first recognized as being involved in metabolizing foreign compounds. What it is a class of enzymes which perform metabolic reactions. Most P450 enzymes are localized in the liver. However, a lot of people don't realize we also have these in our intestinal walls, in our brain, in our lung, and our kidneys, and in even other tissues. So CYP450, cytochrome P450, they are versatile enzymes which perform metabolic reactions. These reactions can affect a drug's pharmacokinetics, which means it could affect their drug absorption, their distribution, their metabolism, or elimination. There are over 30 enzymes, and luckily, we only have to be familiar with a few. So the P450 enzymes that are particularly important in psych are 1A2, 2D6, 3A3, and 3A4, and 2C. And you will see that probably 2D6 is the very most important, but it's important that we have an understanding of all of these. And in case it's ever a Jeopardy question, what does cytochrome P450 stand for? Well, in research laboratories, these enzymes were examined in artificially created spheres of tissue called microsomal vesicles. The cyto stands for the microsomal vesicle. Chrome stands for colored. When these enzymes are placed in these vesicles, they give off a colored pigment and absorb light. P stands for pigment, and 450 stands for 450 nanometers wavelengths of light. That means that these pigments, they absorb light at a wavelength of 450 nanometers. So you can read this slide, but look at number 2, source of inter-individual variability and drug metabolism. Another word for that is polymorphism. Polymorphism is a genetic-based difference in enzyme structure. We might conclude that a patient has failed on an antidepressant trial when in fact the failed trial could be caused by the introduction of a medication that induces the antidepressant's metabolism, causing serum levels to drop to ineffective levels. Or reversely, a patient could become labeled as sensitive to side effects when their side effects might be caused by increased serum levels due to the presence of an inhibiting medication. So, for example, a patient taking pain medications who request a higher drug may be called a drug seeker when in fact a drug interaction has caused the narcotic to be less effective. So a substrate is the object drug. It is a drug ingested into the gut that serves as a substrate for the liver enzyme known as P450. So it is simply a drug that is metabolized by a particular enzyme. When the drug substrate is absorbed into the liver, a biotransformation occurs via the cytochrome P450 enzyme system, where the drug substrate is biotransformed and released in the bloodstream so that drug can eventually be excreted and eliminated from the body. So in other words, a substrate is a medication that will be acted upon or broken down by a particular enzyme. Enzyme induction. This is a drug that will result in lower serum concentrations of the drug affected by the enzyme. So induction is increased enzyme activity. An inducing drug stimulates the production of extra enzymes. So if your patient is taking a medication that is metabolized by these same enzymes, then the medication will be broken down more rapidly, which can lead to lower levels, which will lead to less therapeutic effectiveness, less response to symptoms. A precipitant drug can induce enzymes that enhance the metabolism of the object drug or substrate drug. The substrate drug can be broken down quicker, so it may require a higher dosage in the presence of an inducer drug. And one thing important to know in psych is something about, to know about Tegretol. Tegretol is its own inducer. It induces its own metabolism. So, I'll say it again. Tegretol induces its own level, which makes side effects worsen. So some drugs can increase their own metabolism. However, this isn't something we see right away. Enzyme induction is something that may take 3 weeks before we see it. So more drug is required when taking an inducer drug with a substrate drug. Dilantin is an enzyme inducer. If a client is stabilized on Coumadin and Dilantin concurrently, bleeding could occur if the Dilantin is discontinued or decreased without adjusting the dose of Coumadin. And again, induction doesn't kick in right after the patient takes the inducing drug. It takes 2 to 3 weeks. And why? Because it takes this long for the liver to produce these extra enzymes. And let's talk about inhibition. Inhibition is the opposite. It's reduced enzyme activity. So enzyme inhibition is the capacity of a given drug to inhibit the metabolism of a specific agent, causing an increase in serum concentration of the agent. The onset is more rapid than enzyme induction. Inhibition occurs when 2 drugs compete for the same metabolic enzyme. These interactions are more frequent when drugs have a narrow therapeutic index. So it's important to remember that drugs that inhibit a substrate of the same enzyme have greater risk of hepatotoxicity, so greater risk of causing harm to the liver. And there's an important equation. And we want you to know this. Yes, you can look up drug interactions online, Hippocrates, whatever you want to use. You can look up drug interactions and know which medications not to give. But what is important to know, because of the P450 system, and 2 medications might not be contraindicated, but they could still cause adverse effects. So we really need to learn what medications are involved, what psych meds are involved in this metabolism process. It's very important to know and to be able to talk the talk. We need to be able to say, well, Zoloft is a 2D6 drug. It's metabolized by the 2D6 enzyme. And if you have problems understanding this process, always remember these equations. A substrate plus inhibitor equals an increased substrate because it inhibits or slows down the metabolism of the substrate. A substrate plus inducer equals decreased substrate because it induces or speeds up the metabolism of the substrate. If you always remember these equations, this will help you have a good understanding of the process. Now, for there to be a problem, the drugs must be, the substrate and the inhibitor must be metabolized by the same enzyme, such as 2D6. And in your in your module this week, there is a chart from Dr. Flockhart. The students last semester found a site to order this chart to carry around with them in practice. This is a wonderful chart because it lists the medications that are 2D6, that are 1A2, and you can use the equation we just talked about. This slide talks about the table and how you will use it, but it's very valuable. Okay, so we've just talked about induction, inducers, inhibitors, so you can read this on your own. This is more examples. So let's talk about CYP1A2, one of the isoenzymes. So if you look at, remember the equation, substrate plus inhibitors equals increased substrate. So what this means, if someone takes theophylline, which is a substrate, plus Prozac, which is an inhibitor, we would have increased substrate, which means we would have increased theophylline. Now look at the reverse equation. Substrate plus inducer equals decreased substrate. So look at the list of substrates and you see TCAs, tricyclic antidepressants. If someone's on a tricyclic and they smoke cigarettes, theoretically the tricyclic level could go down, meaning they might need a higher dose of tricyclic for the medication to be therapeutic. There is an article in this week's module about the role of cigarettes in the metabolism of psychotropic medications, and I encourage you all to pay close attention to that. And you know, there's a couple things important. I'm sure we've all heard about grape juice and taking it with medication. And if grape juice and Cipro together could significantly increase the theophylline and cause a great deal of risk. And there's little things like cigarette smoking and eating meat that's very, very well done, I mean charred, can induce enzyme 1A2 and may therefore decrease blood levels of all psychotropic medications metabolized by 1A2, such as Clozaril, Luvox, Haldol, or TCA, Zyprexa. Moving on to the next group of enzymes, 2B and 2C. And again, if you do substrate plus inducers equals decreased substrate. So methadone plus phenobarb would equal decreased methadone. And 2% of the population are without these enzymes. So when someone is not responding to medications the way they should, genetic testing, the P450 testing, is a wonderful thing to do. So 2% of the population don't have these isoenzymes. 20% of the population have them, but they're not sufficient. 15 to 20% of African Americans and Asians are poor metabolizers of 2C substrates. So this is very important to know when we're prescribing psych medications. When we're looking up a drug, it often doesn't tell us that Asian Americans might be poor metabolizers of 2D6. We need to be thinking about this when we're prescribing medication. 2D6 is one of the most important pathways in many drugs. And there's a lot of polymorphism issues. 8 to 10% of Caucasians are deficient in this enzyme. So they are poor metabolizers of TD6 substrates. They don't have enough of the enzyme. 1 to 3% of African American and Asians are poor metabolizers of this. And again, polymorphism, that's a genetically based difference in an enzyme structure that results in altered enzyme activity and a distribution of extensive metabolizers or poor metabolizers. So thinking of our equation again, substrates plus inhibitors equals increased substrate. So if we gave TCAs, tricyclic antidepressants, with selective serotonin reuptake inhibitors, it's not a contraindication at all. In fact, we do this very commonly. But no, SSRIs can inhibit the metabolism of tricyclics, which could increase the rate of your levels of tricyclic antidepressants. They do have therapeutic levels that can be assessed by laboratory testing. Therefore, this could increase the risk of serotonin syndrome. Doesn't mean we don't give it, it just means we educate our patients about the symptoms of serotonin syndrome and what to do if they occur. So an antipsychotic And you notice some of these medications, like antipsychotics, can be substrates and inhibitors, which can further complicate issues. And again, just remember the equations, substrate plus inhibitors. There are several factors that influence the P450 system. There are many, we've mentioned some of the ethnicity issues. It's important to know there's so many different ethnic issues, and that was touched upon last week in Susan's discussion board post. And one thing I've mentioned several we've discussed here, but Ethiopians tend to be ultra rapid metabolizers. So if you are working with a client that is Ethiopian and you give them a medication with another medication, let's say they're 2D6 drugs, they could get rid of the medication so fast that it's not even working. Asians tend to be very poor, and some African Americans can be poor metabolizers of 2D6. Some Hispanic groups may require lower doses of antidepressants and antipsychotic medications and may be prone to increased side effects at normal doses of these medications. Hispanics groups may metabolize drugs regulated by 2D6 faster than Caucasians. And so minimizing risk of drug-drug interactions, I'm going to let you all read this slide, but I would like you to go down to include over-the-counters in your assessments. There are some over-the-counter medications that could affect the P450 system, but it's very, very important to find about herbal remedies. They are not regulated by the FDA. Using St. John's wort and Prozac could be lethal. So it's very important to consider. Even online, there's many herbal remedies people buy online for smoking cessation, weight loss. We need to know about these and know how they may affect the metabolism of our drugs. And if you aren't familiar with the herbal agent they're using, pharmacies are very good with having that information on hand. Studies have shown that the top 10 adverse drug reactions in psychiatry, that these are the type 10. And look at the last one, SSRI plus TCA, not contraindicated, but we do it. But these adverse drug reactions are all related to the P450 system. And I mentioned St. John's wort. St. John's wort is a potent 3,4 inducer, and it can have very detrimental side effects with use for many psychiatric drugs. And a note about Tegretol, because what we mentioned about it before, it also has so many P450 issues that I personally never use Tegretol. There are too many other choices to use that are much safer, but that will be your personal opinion and what you learn in practice. But just as a rule, I've seen a lot of bad things happen with Tegretol, and I don't use that in my practice. Okay, that is the end of this week's lecture. It is a short lecture, but it's a concept that's very important to know, and there are videos on D2L. I like to see things in action. I'm more of a visual learner, so they really are, I think, are helpful. And please let me know if you have any questions about this content. But again, if you just remember the equations and use the flock chart, you will be fine. You will have a deeper understanding